Welcome. So I hope everyone had a lot of fun this morning. We've had a lot of fun just these last couple of minutes chatting about experiences of interfacing with the lawmakers, and it sounds like they're receiving this information very, very well. So congratulations to all of you on good meetings and great impact, let's hope. I'm really excited to hear from our team today over the lunch. Folks who are living with the challenge of lead safe or unsafe homes, and people who are actively involved in community organizing and the regulatory framework, and just setting the vision for a better and healthier future. So Tina, thanks for including us and making sure that this day came together really well.
Yeah. And Conan is going to kick off our DHHS panel and be able to lead that. So I really appreciate him being able to do that with us, and for DHHS as well. And a big thanks to Abigail from Healthy Homes out in Grand Rapids, and Mary Sue, who is here with us today. They were able to work with some parents to help us hear from parents and grandparents and family members to really help put a face on what the work that we're doing and why we're here today. I know TaNiccia was in one of my meetings, and her story was very compelling and really resonated with our lawmakers. And so the parent voice is, in my opinion, the very most important voice. And we're so lucky to have two wonderful parents here with us today. And so I'm going to turn it over to Mary Sue Schottenfels. Most of us know Mary Sue. She has been with us from the beginning. She is the founding director of CLEARCorps Detroit, and now she is consulting with the Wayne State University Center for Urban Studies. And so I'm going to turn it over to Mary Sue.
Good, thanks, Tina, and thank you all so much for what you've already done today. I know our meetings went very well. The reps were very responsive, and it's been a great day so far. I'm really happy to be asked to host this panel. I think parents, you all have the experience, you're the center of all this, and I'm happy to introduce two incredible parents, and they're going to tell you their own story and their journey with lead, and then we'll get into a Q&A. But first, let me introduce them. First, we have TaNiccia Henry, who is a Detroit parent, very active with the group I work with, which is called D-LED, and that's a parent advocacy group out of Wayne State University Center for Urban Studies. TaNiccia's a key leader in that group. Fifth generation in her home, and as she'll tell you, she's got grandchildren, and one of them had an experience with lead. But she's also an entrepreneur and a football coach. That's her real claim to fame. And Shantal, I'm so happy you're here today. Shantal's from Grand Rapids and has also been very active with their group, and that group is called Parents. What's your group called? Parents
for Healthy Homes.
Parents for Healthy Homes. Chantel is a mom of four, and she recently got engaged, I hear, so congratulations.
Thank you.
And with that, I'm going to just start off by asking the main question, which is, ladies, how did your family get involved with the lead issue? Tell us your stories.
Go ahead, Shantal.
Okay, well, I got involved back in 2017. I had a child who was exposed to lead, and I ended up getting involved with Parents for Healthy Homes shortly after that, just because I was fed up with no one taking accountability and things like that, and I had just ran into so many different things when it came to dealing with landlords over the years and whatnot. So I'm just here today to share my story and let you know that lead is a crisis in the Grand Rapids community. Our city, 49507 zip code, has like the highest number of lead poisoned children, due to the large part of the repeat offender homes. And those are basically homes that are known to have lead in them, but they've been repeatedly either rented out or they've been sold to multiple different families or whatnot. And that home has poisoned at least one person, if not every member of that family that stayed in that home. Because of this, I think this is because our current, housing code policy isn't being enforced. And it does like the bare minimum to look for lead. the tenants are like frequently being exposed to the lead with there's little accountability taken. The landlords aren't taking the action, you know, that they really need to, you know, face these issues and get them taken care of or whatnot. There's no like they're not addressing the problem. They're not helping put preventative measures in place and things like that. So in my opinion, you know, this is part of the reason why the community of Grand Rapids has one of the highest number of lead poisoned children in the state of Michigan. So like I was telling you as before, my 5-year-old, she's 5 now, but she was a victim of lead poisoning. She was just 1, getting ready to turn 2 when me and her father found out, you know, that she had lead in her system. And we all know, according to CDC regulations, that anything under a 5 is considered okay. But my daughter, her level was a 9, you know, all because we had lived in this lead infested home and she was exposed to lead dust. And I wasn't educated and privy to know that that was a danger in my home, you know what I mean, for my child. And, you know, what do you do at that point then? So we reached out. We had lead testing done by multiple organizations, including like Healthy Homes Coalition. We had the property management company, which was Lighthouse Property, come out to do theirs. Also, the health department came out. All their test results came back with levels that were higher than factory regulated levels, which is ridiculous. You know what I mean? So the property management company, they didn't address the issue or anything for me, but they still asked me to pay rent every month after that. You know what I mean? And if I didn't, I got a complaint or a demand for possession of rent or whatnot. So I personally went a step further. I applied for the Get the Lead Out program that we had in the Grand Rapids area to get the remediations done. And it seemed like everything was good. The property owner was going to go ahead and go forward with everything, and then they backed out the last minute. We'll come to find out later on that the reason they backed out was because the program only offered so much funding to be allocated. And if the remediations were more than that, they were still liable and would be held responsible if it wasn't taken care of. So I was stuck living in that 3-bedroom home, you know what I mean, for that time being because of financial restraints. I couldn't just pick up and go, you know what I mean? And then when you think about the fact that, you know, there was other families before me in here, and, you know, just for the record, I stay close by my old home. There's a new family in there now. So, you know, I want legislators to know that and understand, you know, at the end of the day, that lead poison is 100% preventable, 100%. But it's 100% irreversible once it's entered the body. Our children are our future, and our future depends on our children, and that's what we need to remember and keep at the forefront. And, you know, we need to also remember that if we're not doing anything to help stop or put some preventative measure in place, we're not only destroying their future, our children, but we're destroying ours as well too, when you think about it. And that's not okay. So that's my personal story and why I do what I do.
That's fantastic. Thank you. And we'll come back to you in just a moment with some questions. TaNiccia, come back to us. Okay, so this is TaNiccia from Detroit, and she's got a story, quite a story too.
Hello, everyone. I thank you for taking your time to listen to my family drama. I am a grandmother of a now 9-year-old. At the age of, I think he was 5. Let me rewind this. My daughter was not on Medicaid. I paid for his doctor visits. That part of the story is very important up until the age of 5. Then she got Medicaid and he was tested for lead. And his test, the finger prick came back at like a 42. Then they came back and they drew blood from his arm and it came back at a 27, which is terrible. At the end of the day, it's terrible. No amount of lead is acceptable, but once you get past 5, it becomes detrimental. And I'm going to use his name, Lloyd. His hair started falling out. It just completely just stopped growing at one point, and I couldn't figure out why. His skin, it changed. It was discolored. I have eczema. So I made my daughter take him to the doctor to make sure it wasn't eczema, because to me, it just looked like dirt in his skin. And I'm like, get some alcohol, wipe his feet. What's wrong with it? So we took him to the doctor. He was tested for lead. That's when we found out his lead levels. About maybe a month after, they sent a nurse out to the house. She's a beautiful person, Nurse Brown. And this is the treatment at this point. We need him to eat green leafy vegetables. We need him to take multivitamins with iron every day. Plenty of fruits, vegetables, and dairy. And that was pretty much it at that point. So later on, maybe 7 months into this, I'm like, okay, his lead levels are not going down. I mean, they went down like 2 points here, 3 points there. A year later, he was at 18.
Wow.
Right. That was a whole year later. So he was at an 18, and I'm like, okay, what am I not doing right? So what I did was, it was certain things that I completely took out of his diet. I'm not a Kool-Aid drinker. My kids drink Kool-Aid, but they buy the Kool-Aid that's already mixed, and then you just pour it in water, shake it up like a Crystal Light packet. I stopped that. I literally took all of his toys, everything. I threw them out. His levels started dropping much faster then. They were falling much faster. Okay, I'm like, okay, I'm doing something right. So then the nurse suggested I go to a DLAD meeting. And that's where I met Mary Sue and and Izelda. And I learned how to properly clean. Most of us don't know how to properly clean. We usually do not think about the fact that we're moving dust around. I had AmeriCorps. Was that AmeriCorps or CLEARCorps? One of them came out here and helped me. They taught me how to get the floors completely cleaned and all of that, and how to keep them clean. Because of course we use a broom. I have hardwood floors. I also have a 100-year-old house. My house is 97 years old. And I live in the Boston Edison district, which is 48206, for those who don't know, in Detroit. Some of the oldest homes in the city. And when I woke up this morning, there was an article on my phone for Smart News. And it was about this area. In this area, 48206, I want to make sure I'm right. 48206, the elevated lead in children is 15.5%. That's ridiculous. 15.5% because of old homes. But anyway, so now his lead levels at this point don't matter to the world because he's over 6. Just so you know, when they get over 6 and they age out, they really don't care at that point, because they feel like, I don't know if they feel like, oh, well, it's too late, but he's 9 years old. His lead levels are good. Now I still have him checked regardless. He's a football player. He is delayed in school. He's delayed in reading. He's delayed in math. His cognitive skills, they're, I mean, realistically, I know this is going to be a lifelong problem, and I have to work extremely hard with him to hopefully make sure he leads a normal life. Had he been tested at 1, 2, 3, 4, maybe it would have been better. But I just don't want him to be in the system with quote unquote ADHD, kidney problems. Kids have all types of things. I mean, he could end up doing something impulsive just because he has this lead issue. I went to Wayne County, and I've talked to them several times, and I've told, and they agreed with me that all children should be tested. Children are not being tested. If you're not on Medicaid, you are not automatically tested.
Mm-hmm.
I worked at Ford Motor Company. I paid cash. I have 3 children. They are now adults. They've never been on Medicaid. Most of us working people have insurance companies that are refusing to check our children. And we don't know that they're not being tested for lead, or we don't know lead is an issue. A lot of people think that lead is a issue for poor people. No, it's not. It's not. At one point in time, I made very good money. Very, very good money. And lead is still an issue. No matter how you do it, it knows no boundaries. Not race, not economics. It's just there, and it's all over our state. We need dollars, number one. We need a mandated test. Every kid has to be tested. Every kid needs to be tested once a year. If you don't know that by now, and I'm sure you guys have been in meetings for the past 3 hours, it's very important that we all are tested. We all get our children tested, because at my age, it doesn't matter. Whatever's going to happen is going to happen. But our children are our future, like she said.
Right. So ladies, I appreciate you so much. We just have 1 more minute before our panel starts. These were very powerful statements. We hope that both your kids are doing well. It sounds like they are. Shantal, your daughter's doing well, I hope.
Yeah, she's doing better. She doesn't have any lead in her system. It's been ridded. But she does still have some of the effects, the learning delays, retaining information. Like TaNiccia said, I have to really work with her to retain things. I have to come up with, certain types of games that are privy to her to get her to really get things, you know what I mean? So it is a little extra work that we have to do as parents, you know what I mean? Not saying that that's our babies, we're gonna do it regardless, but if we didn't have to do that, we would. If we had an option, we would choose the other option. Right. You know what I mean? So definitely all the support we can get within, our communities. We're even getting to the point where we're trying to see some housing code policy changes and advocating for things like that, to like you said, put some stipulations in place, that once a year thing. And she's right. We found out through our group that, people who aren't on Medicaid are not getting that testing done, or who aren't receiving WIC or things like that, aren't getting those testing and things done. And like she said, after a certain age, it's like they cap out and they don't test them anymore. And they need to still be tested. In my opinion, any child under the age of 13, 12, That's still a developmental stage for that child. So they should be tested every year and things like that. And also there should be some lead testing done on these homes prior to them being re-rented out or resold and things too,
That's one of our
prior to those
concerns.
families coming in.
Right. Well, I want to thank you both so much, and also thank you for being leaders in your group. So you're not just sitting back, your kids have an issue, taking care of it on the home front, you're taking care of it for the community. So we really appreciate both of you, TaNiccia and Shantal. And with that, I'm going to turn it back over to Tina. Thank you. Everybody in the chat saying you did a great job.
You guys, thank you so much. Before we let you go, Shantal and TaNiccia, could you talk about how you think the impact of the policies that we've been educating people about today what that would mean for you? Like if we had universal testing, for example, how would that have changed your lives?
You want to go ahead, Shantal?
For me personally, it wouldn't have, I think that would have helped and not driven an emotional wedge in my family. I felt like my kids couldn't be kids. I couldn't love on them the way that they needed to be loved because I had to be so strict all the time. You know what I mean? So when you think about things like that, the funding that we're asking for these things to be put in place, it's going to relieve that stress and things like that for those families. It's going to improve our health system. It's not going to be costing the health. It might cost a little bit now, but later on down the line, it's not going to cost our health officials as much to deal with the issues that come with being lead poison or whatnot, because it's going to save us money in the long run by putting these preventative measures and stipulations and things like that in place. And also it's just going to make our future better because we're not harming our children. We're not negating them from being able to get that education for where they need to be, the positions that they want to be in. If we want them to be in these Senate and legislator seats or whatnot, without having these stipulations and hindrances in place, they don't have to put in as much. They have to put in that extra effort to try to feel just as normal as another student or a child who's in the same grade trying to do the same things that they are. So that's also going to help boost their confidence as well too, because some of them will feel less than because they feel like they can't get things versus so they see another student that they're working with and they're like, they get it like this and I'm struggling, and they're like, why? And then you have to explain to them why they're having that issue that they're having. And it's because, sweetie, I'm sorry, it was just because you breathed in a little dust, you know what I mean? So it's going to help so much in so many different areas that I think even we aren't privy to what this is going to do. We think we know, but once it actually hits and we see, it's going to be so much grander than what we expected.
Well, in my situation, I'm going to be completely honest. My grandson, whatever damage is done, I do have another grandson. So if I can't do anything else, I like to save the next generation or the next child. Period. Now, whoever knew that they didn't require a lead test? I never knew that. Whoever thought about a lead test? Okay, Flint came along and everybody was on the lead bandwagon, and you see how quiet that got. My grandson is 9 years old. Yes, he does have learning disabilities. I personally think he's dyslexic, but according to them, he's not. Okay. But what I'm asking for is somebody to put it in place that is demanded, expected, so people that don't know don't even have to worry about it. 10 years ago, I didn't know this. So I'm learning on the fly here. I mean, just realistically, in the past 4 years, I've learned more about lead than I did about science. Period. But at the end of the day, we need to save our children. We need to save every child, not just our children. Think of, I'm going to give you an example. There's some 19-year-old young lady walking the street right now that's 8 months pregnant. She just got her first apartment. She has absolutely no idea that her apartment is lead filled.
Mhm.
In 6 months, her child will have lead in his or her system. What happens then? A lot of younger people, and I'm sorry, young people, are irresponsible. My daughter is irresponsible. My daughter was irresponsible. That's why my grandson has been my shadow all his life. But a lot of younger people are irresponsible or just don't know. They don't know how serious it is to care about. At the end of the day, and we're all adults here, right? We wear condoms to protect us from. So let's think the same way. Let's get tested for lead. Let's get these kids tested for lead so that they don't have these problems later.
And nobody should have to go through that learning when it is preventable, as you guys have told us through these stories.
Absolutely.
Y'all, thank you so very, very much for sharing and for putting a really fine point on why we need better, stronger policy in place. It has been very heart-touching to hear from you today, and it makes the work more real and more worthwhile.
Mhm.
Thank you all.
Thanks.
We're going to move into our insider panel. So you all, I am really delighted to welcome 3 of the most influential people in the state on this and many other issues, of course. We're joined today by Elizabeth Hertel, who is the director of the Michigan Department of Health and Human Services. Director Hertel has a whole lot of stuff on her plate right now, as do her teammates. But I know we've gotten a lot of positive feedback from the upper echelons of leadership in DHHS on these issues, and continue to look throughout the entire department for the partnership that you have provided consistently to us. So Director Hertel, thank you for joining us today. We're also joined by Dr. Joneigh Khaldun, affectionately known as Dr. J. Welcome. Dr. Khaldun was the head of public health in the city of Detroit when you and I first met back in the U of M Detroit Metropolitan study days. So it's really nice to have you back as well. And Emily Schwartzkopf is the fortunate for us and maybe unfortunate for her soul who deals with all the policy. So when we out in the audience have been educating lawmakers and we get to do it for an hour or a day, she is tasked with it pretty much every minute of every day. Emily, thank you as well for joining us and providing great leadership on this issue. Could I ask each of you to start just by sharing your own observations about the importance of lead-safe homes and better lead policy, and beginning, Director Hertel, with you.
Yeah, absolutely. Thank you for that introduction, and thank you everyone for having us here. We really appreciate being part of this discussion. We know that children aren't the only people who are impacted by lead in homes and other infrastructure, but childhood lead exposure does remain a serious and widespread concern for us in Michigan, particularly in lower income areas where people live in older and deteriorating housing units. So as a state health official, but also as a parent, I understand and I share the passion for making our kids and families have equal opportunity to live in safe environments. So as you recognized, Dr. Khaldun, who's been a leader in this field for a number of years in the state of Michigan, and leading the Child Lead Exposure Elimination Commission. And from her team, I would also like to recognize, who may be on this call, but I cannot see him, James Bell, who has been spearheading our lead exposure and remediation efforts here in the department as well, especially during this pandemic. We do continue to prioritize the reduction of lead exposure for children. And through our strategies, we're continuing to expand some of those solutions to identify innovations to reduce lead exposure and the consequences in the long term. It will not come as a surprise to many of you that over the last year, we've seen a significant decrease in lead abatement. We believe that is mostly, of course, due to the pandemic. There was a 76% decrease in our childhood blood level testing compared to the previous year. However, we are committed to working with our health partners, providers, all of you, and of course, others to ramp up those numbers again for our testing and remediation. So I want to thank you again for the time here. That's my perspective from a pretty high level. And if you don't mind, I'll go ahead and turn it over to Dr. Khaldun, who's been working on a lot of the specific initiatives, both in the city of Detroit and for the state of Michigan.
Thank you, Director. Really excited also to be here today for Lead Education Day. Obviously something that is very, very important. Myself as a parent as well, really just know how important this is. I also want to thank my team. So James Bell, Karen Spidell, Corey Gresh, Michelle Twitchell. There's many people that I know folks who are listening today are aware of as far as their commitment when it comes to our lead work in the state. But I think, I'll talk a little bit about my work in Detroit and at the state. And I think all of you know that to effectively prevent lead exposure, we really have to think about systems and really developing really strong partnerships. And so I had the honor to work on this with my team in the city of Detroit as well. So what did we do? And again, this is all about partnerships. I certainly cannot take credit for this, but we actually partner with several city departments and community organizations in the city to address lead from multiple angles. So this meant coming together to expand our lead education efforts. I heard about that at the tail end of the last panel about how important just basic education is, of course. We also expanded access to testing and healthcare services. We made sure schools and homes had the ability to be tested. And we also worked really hard to address policies, including in my time in Detroit, strengthening the rental code so that landlords in Detroit are now required to make their homes lead safe in order to rent a property. We also knew in the city of Detroit that there were some zip codes where more than 20% of the kids who were tested had an elevated blood lead level. Which is absolutely just terrible. And we knew that was also just the kids who were tested. We know there were many more who weren't even tested, but who were likely exposed. So again, we built this partnership out, also partnering, I don't know if Like Thompson is on today, but he's been a great leader in the Detroit space as well. But we built out a proactive program based on primary prevention. So we literally hired community health workers, nurses, social workers to knock on every single door in the top 5 zip codes in the city where we knew there were elevated blood lead levels. Literally every single door. We didn't know who lived there, but they got a door knock at least 3 times. And so when we were able to get into those homes, we actually tested them for lead. We tested children, we tested pregnant women, and we also connected those families to abatement services and actually other social services that they may have needed. And so I think this example of primary prevention, not waiting until a child tests positive, is really, really important. You have to activate the system ahead of time, and that's also a part of the critical work that we are doing in the Michigan Department of Health and Human Services. Also, I would be remiss if I didn't mention the Child-Led Exposure Elimination Commission, the CLEARCorps, which I also had the honor of serving on when I was in Detroit and now chairing as the chief medical executive. So really just amazing experts on that commission that I actually learned from every meeting. And so some of the work that our commission is actually doing is, again, supporting, as you all know, the creation of a regulatory environment that not only eliminates lead, but actually makes it easier for contractors to do their work and their jobs safely. We're also working on strengthening childhood lead testing recommendations. Every child who's at risk should absolutely receive a blood lead test. We also have grants that we're putting out across the state, and we have for a couple of years now, to support projects. And some of those projects include using housing codes as a mechanism to prevent childhood lead poisoning, partnering with community-based organizations on home visiting and expanding access to testing, and also doing outreach to medical offices, and particularly some who have low rates of blood lead testing in their offices. And then I also just want to echo what the director said. Of course, very concerned about how the pandemic has really changed everything about public health, including lead testing. We saw a decrease in abatement, as she mentioned. We also saw a decrease in children being tested. And I think as we move forward with ending this pandemic, and it will come to an end, we will absolutely be committed to working with partners, community-based organizations, local health departments, and absolutely expanding access to testing and revving up our educational efforts even more. So again, thank you for the time here. Looking forward to answering a few questions as well. And with that, I think I will pass it on to Emily for a few remarks.
Great, thanks, Dr. J. Well, it's never my favorite thing to follow both the director and Dr. J, but you know, I do want to just echo again what Dr. Hertel and Dr. Khaldun stated about the commitment and the tenacity, I think, of the staff within the department on this issue. I will say they seem like one area of the department that is never scared or unwilling to go talk to a legislator, and that makes my job much easier. So I mean, I guess just in terms of background, I think much of my experience comes from the legislature, having worked there for a handful of years, really in the midst of kind of the Flint water crisis, you know, and just prior to that, you know, there seemed to be a lot of focus about lead remediation in homes and the costs and things like that. And I think throughout, you know, the water crisis that continues, and you know, just having the perspective that, you know, homes really are the kind of biggest factor in terms of lead poisoning. And so I think lots of my role and interest in this is just finding legislative fixes, and how do we make these, you know, kind of the issues that Dr. Khaldun talked about in her work in Detroit, how do we make them occur statewide? And again, a lot of my work is focused on that with the background and influence of our internal staff, who is very committed to some of these legislative fixes.
Emily, we've experienced a lot of support from the legislature over the last few years in terms of funding for lead safe homes, and I've been very gratified by that. And the reported experience from our team of folks today going out to meet with lawmakers is that we found pretty decent reception in the legislature. Do you feel that this is a promising environment for advancing policy around lead safe homes and protecting children from lead?
Yeah, I really do. I mean, I think this is not unique to one zip code. So I think everyone kind of has a story of a family friend or a neighbor who had issues with lead. And I mean, again, unfortunately, I think the water crisis brought, you know, lots of attention to this issue. You know, so we are working on a few pieces of legislation to, you know, get at some of these issues. And you know, I have a list of lead champions that I can work with from both sides of the aisle and from both chambers. And really, you know, I really started working on some of these lead pieces. I think it was around mid-February of 2020. So as you can expect, that kind of took a back burner. But again, as Dr. Khaldun stated, as we kind of work our way, past the pandemic and can kind of externally return to a little bit normalcy, really hope to push on those legislative pieces.
Dr. Khaldun, one of the things that we are talking to lawmakers about all day today is universal testing and the opportunities that present for, you said like catching it on the front end, right? Like how we aren't responding anymore. We're ahead of the game. Can you give us a perspective, your perspective on the value of universal testing and any conversations that you've had with decision makers around this particular policy?
Sure. Yeah, we actually are actively exploring that in the department. I know that's one of the priorities of the lead commission as well. So I absolutely do support it. Just as a doctor, as a parent, I think that's absolutely the way to go. But we're now working within the department to kind of figure out what that looks like and how to best move forward.
When we get pushback from folks about this, it's usually around the cost, of course, and like who's going to bear the burden of it. Will it be insurance companies? Will it be something that is funded through state community health? What would your recommendation be for us as advocates in terms of figuring out how we overcome the challenge to funding this? Is it a federal priority? Is it a state priority? Is it something we should be integrating into insurance? All of the above?
I mean, I'll see if the director, I see her nodding, if she wants to chime in at all, or no.
Yeah, I love to talk about the money. So yeah, it remains a priority for the department. This remains a priority for the governor as well, which has been evidenced, I think, in her last couple budget executive recommendations to maintain funding, expand opportunities to help property owners update and upgrade their homes to make sure that kids are not being exposed to lead. What is really important for us at the state level in keeping this a priority for the department is the work that all of you are doing and working with your legislators and telling your stories and making sure that it is a priority for them, that they know that it is a priority for their constituents so that we can maintain and expand the work that we're doing.
Do you see opportunities in the federal conversations that are happening now around COVID recovery and economic recovery that we might be able to find some funding for programs like this?
I think that in the newest discussion around a federal infrastructure bill, that this is something that would fit very nicely into our continued discussions on infrastructure. Infrastructure covers so many things now, both bricks and mortar in houses, water pipelines, trunk lines, our highways, but also, our internet capabilities and those sorts of things. And all of that infrastructure really does contribute to our public health outcomes. And I think that this is a really important lever for us to be able to find some additional expanded federal support to continue these efforts.
That's really,
and maybe, oh, sorry.
No,
I was all excited about that. But because I think, public health is never appropriately funded, right? And so I think the more that in public health, we can think about blending, braiding funding, finding opportunities to tag along with whoever else got the dollars. So we're actually looking at, even for lead testing, can we build upon our vaccination efforts that we have in different neighborhoods and our mobile strategies? When I was in Detroit, we were going to schools already. Can we bring in the hearing and vision testing with the lead testing as well? So again, however much we can kind of ride the tail of any other funding that's out there, I think we absolutely should be looking at that.
I want to play off that enthusiasm with something that you said, Dr. Khaldun, about the opportunity for policies around lead-safe homes. Like, one of the things that we're talking to lawmakers about today is, can we get disclosure incorporated into the transfer of a property or into the rental of a property? You mentioned, of course, that Detroit has an ordinance, but implementation of any policy depends on partnership. It depends on the ability to enforce. It depends on private sector actors doing the work and having the capacity to do the work. if there is infrastructure funding that comes in, as the director has pointed out, and we start thinking about housing as one of those infrastructure opportunities, could we create incentives through that to advance these kinds of local policies and then see those communities who have local policies ramp up implementation?
Yeah, I think, yeah, that's a really creative idea around how to utilize that funding. Yeah, absolutely. I think that's really interesting. I think we have a lot of opportunities here to think about the ways that we can move initiatives forward in this space and other spaces as well. If we're able to get an influx of dollars that we never had access to before. And so continuing to develop and think about creative ways to incentivize people to make these changes will be really important.
Emily, there are a number of questions that are coming to us that are sort of centered around if there's funding, but not a lot of implementation policy, what's the gap here? Why is there a momentum challenge in the legislature when we have dollars that could be spent? Can you share some of the dynamics in that budget process that you're observing right now?
That might be a longer conversation than you have time for.
Yeah, and I will definitely, of course, let the director jump in here as well. I mean, I think, a lot of it's competing priorities. I mean, the budget process is an animal in itself. I guess I don't even know where to start. But, I think that there continue to be opportunities. I think, when you see the cost of doing X project, it seems like, and say it only remediates 50 homes, right? Perhaps legislators don't feel like that's enough bang for their buck. But, we continue to work on it. Again, as the director, I know that this is a priority of the director. I know it's a priority of Dr. Khaldun, and especially Dr. Khaldun has really unique experiences in implementing these policies and coming up with unique ways. And again, just don't want to beat it to death, but like the staff within the department is just so helpful in coming up with creative solutions, I think, and ways to talk to legislators about the importance and just all that goes along with budgeting and policy making.
There are opportunities, Dr. Khaldun, that you mentioned for us to sort of piggyback and leverage work that's ongoing. I think about in the environmental council's work, we're very interested, for example, in ensuring that more homes have energy efficiency measures put into them. When we go into homes in some communities, we're often turned away from that work in weatherization, which I know is a DHHS function, because of what we call health and safety walkaway issues. And lead is one of those issues we sometimes encounter, lead paint in homes. Is there an opportunity to think creatively about how we do lead remediation in order to get to energy, for example, if energy is suddenly a priority in the climate change conversation that's happening at the federal government? Where do you see those synergies that might let us sneak in public health around other people's funding priorities?
No, I absolutely think that's the right way to go. I mean, I don't have a specific kind of example of what opportunity, but I think, again, I'm so used to sneaking in the back door. I mean, even in Detroit, we had the Office of Sustainability, and they were getting a little funding, and they were doing their report. So we kind of brought our lead strategy together with our sustainability strategy. But I think it's absolutely important. And again, Mary Sue, I think you're on as well. But yeah, I think that work is really important.
The last thing I'll ask each of you, that we have about 100 folks from all sorts of professions talking to lawmakers today. So family members who have been impacted by lead poisoning in their homes, medical professionals, public health professionals, advocates, building owners, the works. Everyone's out there trying to elevate this. what would you like to share with that community of advocates to help them stay inspired and doing this good work that supports you?
Should I start? You know, I would just say, again, as a parent, as a doctor, this work is incredibly important. I think sometimes you can feel like you're pushing a ball up a hill, you know what I mean? Like you're never making progress, but it's absolutely so important. I think keep on waving the flag. Make sure everyone understands there's no amount of lead that is safe in a home. And these are people's lives. These are not, we always have statistics and we look at trends, but every single life is important. These are people's lives, these are people's children, these are, you know, the next adults of our society. So I think just keep up the great work. I'm certainly proud and honored to be walking with you in this as well.
You know, I think to echo Dr. Khaldun, I think just also understanding that it is such a commitment for our department. And I guess just, again, we as Dr. Khaldun mentioned, you know, this is people's lives. I guess I would caution patience as, you know, we face a number of challenges in the past, you know, especially in the past year. And I think just, you know, keep the drum beating and people aware.
Director Hertel, can I give you the last word?
Yeah, I just want to say thanks again for having us join you today. I'm really excited to hear about all of the outreach that you're doing with the legislature. Keep it up. We're behind you, and you know where to find all of us. So thank you so much.
I cannot believe Tina Reynolds, our program director for health. Thank you so much for this day. The fact that you recruited this incredible panel. How wonderful to hear from the top leaders in the state. That really does show the commitment of the state of Michigan to creating lead-safe homes and lead-free families. And I can't thank all of you enough. And Shantal, TaNiccia, Mary Sue, everyone who joined us for this lunch panel and lunch conversation. Bless you all. I know we're off to 1 o'clock meetings with more lawmakers, so go to it. Tina, any final instructions to the crew?
No, just a big thanks for everyone participating today, and our big thanks to our panelists and especially our parents that were sharing such personal stories. You're the reason that we're doing this work. You know, best of luck to your meetings. Be sure to take notes, and we'll put our heads together about what to do with the input that we got from our lawmakers. Thanks, everyone.
Thanks for listening.
Thanks, everyone. Have a
Thank
wonderful
you.
day.